Welcome to the STEMS Health Miami Stem Cell Therapy Podcast. STEMS Health is a regenerative medicine clinic in Miami Beach, specializing in advanced non-surgical treatments that help the body repair and restore itself. Visit stemshealthregenerativemedicine.com for more info or to book an appointment. From stem cell and PRP therapies to peptides, IV treatments, and hormone optimization, our focus is on helping you feel, move, and perform at your best. This synthetic podcast brings you clear, physician-guided insights into how these treatments work, what to expect, and how regenerative care is transforming modern medicine. Now, here is today's topic. Revolutionizing medicine, how stem cell transplants drive tissue and organ repair. Stem cell transplantation has transformed from a high-risk, last-resort treatment for blood cancers into one of the most sophisticated and powerful tools in modern medicine. Today, these transplants not only save lives, they also help restore the body's ability to heal, regenerate, and even repair tissues and organs indirectly affected by disease. In this episode, we'll unpack what stem cell transplants really are, who they can help, what the procedure involves, and how this therapy is now being explored for conditions far beyond cancer, including autoimmune diseases and tissue damage. What are stem cell transplants? To understand this medical breakthrough, we have to start with the stem cells themselves, specifically hematopoietic stem cells, or HSC. These are the master cells that live inside your bone marrow. They can renew themselves and transform into all of the body's blood and immune cells. In a stem cell transplant, technically called a hematopoietic stem cell transplant, or HSCT, these cells are collected either from the patient, called an autologous transplant, or from a donor, an allogeneic transplant. The cells are then infused into the bloodstream after the patient's diseased marrow has been cleared or suppressed through a conditioning regimen. The goal is simple but profound. Remove the damaged or cancerous marrow, replace it with healthy stem cells, and allow those new cells to rebuild a functioning immune and blood system. Where do the stem cells come from? There are three main sources of transplantable stem cells. The first is bone marrow harvest, where stem cells are taken directly from the pelvis under anesthesia. The second is peripheral blood stem cell collection, where medication is used to move stem cells from the marrow into the bloodstream, allowing them to be collected through a process called apheresis. And finally, there's umbilical cord blood, which is collected at birth and banked for future use. Cord blood has become a valuable option when matched donors are unavailable. Each method has its own advantages depending on the patient's condition, donor availability, and treatment goals. Stem cell transplants were originally developed to treat cancers of the blood and bone marrow, diseases like leukemia, lymphoma, and multiple myeloma. But today, their use has expanded. They're also being used to treat inherited blood disorders, certain bone marrow failure syndromes, and even autoimmune diseases such as multiple sclerosis and systemic sclerosis in research settings. The decision to move forward with a transplant involves careful evaluation by a transplant hematologist. They'll assess disease status, age, organ function, and overall health to make sure the patient can safely tolerate the procedure and the intensive recovery that follows. A successful transplant isn't just a medical event. It's a team effort involving doctors, nurses, caregivers, and the patient working closely together throughout the process. Preparing for the transplant, conditioning and donor matching. Before the transplant itself, patients undergo conditioning, a course of chemotherapy, sometimes with radiation, to eliminate diseased cells and make room for the new ones to take root. There are two main approaches: myeloablative conditioning, which uses high-intensity treatment to fully clear the marrow, reducing relapse risk but carrying higher toxicity. Reduced-intensity conditioning, which is gentler and often used for older or more medically fragile patients. For donor-based transplants, matching is critical. Doctors look at HLA markers, genetic identifiers that help ensure compatibility between donor and recipient. The best matches are usually siblings, but if no family match exists, donor registries or partially matched or haploidentical family donors can be used with specialized prevention protocols for graft versus host disease, known as GVHD. In some cases, cord blood offers another safe and accessible source. Once the conditioning phase is complete, the actual transplant happens. often called day zero. The stem cells, which may have been frozen and stored, are thawed and infused through a central IV line. It looks much like a blood transfusion. After infusion, the cells travel through the bloodstream and settle into the bone marrow, where they begin to divide and form new blood and immune cells, a process called engraftment. Neutrophil engraftment, or the return of infection-fighting white cells, usually happens within 2 to 3 weeks. Platelet recovery takes a bit longer. During this time, patients are closely monitored for infections, fatigue, nausea, and mouth or gut soreness. Hospital teams track blood counts daily, provide transfusions, and administer medications to support immune recovery. Once the new cells are established and symptoms stabilize, patients can usually be discharged, continuing follow-up care as their immune system rebuilds. Every stem cell transplant carries potential risks, but medical advances have dramatically improved safety and outcomes. One of the most serious complications is graft versus host disease, or GVHD, when donor immune cells attack the patient's tissues. GVHD can affect the skin, gut, liver, and other organs. Fortunately, preventive strategies like calcineurin inhibitors, methotrexate, and newer immunosuppressive drugs have reduced both the frequency and severity of GVHD. Other key risks include infections, especially while the immune system is still rebuilding. Transplant centers use proactive monitoring and preventive antibiotics to minimize this. Patients also follow a detailed vaccination schedule once their immune function returns. Doctors carefully balance disease control with minimizing transplant-related mortality, which refers to complications unrelated to the original illness. Advances in donor matching, supportive care, and infection control have lowered this risk significantly. One of the most exciting developments in this field is the growing realization that stem cell transplantation can do more than cure blood cancers. It can also help reset the immune system and indirectly repair damaged organs and tissues. In autoimmune diseases, the idea is that a transplant can reboot the body's immune system, eliminating the cells that were attacking healthy tissue and allowing it to rebuild itself in balance. By stopping the root cause of inflammation and immune dysfunction, the body can begin to heal, restoring organ function and reducing long-term damage. This immune reset concept is being studied in conditions like multiple sclerosis and lupus, where early trials have shown promising results. It's important to note that this approach is very different from the unregulated stem cell injections sometimes marketed online. True transplants are performed only in accredited medical centers under strict research or treatment protocols. The journey doesn't end with engraftment. Long-term follow-up is essential. Survivorship programs help monitor for late effects, like hormonal changes, heart or lung issues, and secondary cancers. They also provide guidance on mental health, nutrition, and returning to normal life after such an intensive experience. For patients in South Florida and beyond, partnering with an accredited transplant center and surrounding that care with strong rehabilitation, nutrition, and lifestyle support can turn a medical milestone into lasting recovery. Stem cell transplantation represents one of the most powerful examples of how modern medicine can harness the body's own biology to restore function, rebuild health, and even repair damaged systems. What began as a treatment for leukemia has evolved into a platform for true regeneration, one that is rewriting the future of cellular medicine. If you'd like to learn more about how these therapies are evolving or whether you may be a candidate, schedule a consultation with STEMS Health in Miami Beach, where science and compassion come together to advance regenerative care. That's all for this episode. Thank you for listening to the STEMS Health Miami Stem Cell Therapy podcast. This podcast is for informational and educational purposes only and does not constitute medical advice. Listeners should consult a licensed healthcare provider for individual diagnosis or treatment. Some therapies discussed may be considered investigational or are not approved by the FDA. Results and outcomes vary for each person, and no guarantees of benefit are implied. All participation in such treatments is voluntary. To learn more about regenerative and restorative treatments, visit stemshealthregenerativemedicine.com or schedule a consultation at our Miami Beach clinic. Stay tuned for the next episode of the Miami Stem Cell Therapy podcast and have a great day.